A palliative care journey may begin when you receive news from your doctor or hospital medical team that a palliative approach will now be taken to your care because your health condition has changed and treatment aimed at a cure is no longer possible. A palliative approach will focus on helping you to live as fully as possible for the weeks, months, or years ahead. What is important for achieving your goals and maintaining a good quality of life for you, your family, and carers will guide decisions about your treatment and care from now on.
Many people believe that a palliative approach is only available for people with advanced cancer. But those living with illnesses such as dementias, motor neurone disease, progressive diseases of the heart, lungs, liver or kidneys can benefit from a palliative approach to their care too. A palliative approach doesn't mean that medical treatments stop. Surgery, chemo or radiotherapy and other medications might still be helpful, but the aim of those treatments will be to improve your comfort and manage your symptoms rather than to cure the disease. A palliative approach can be provided by many different services. Trying to find out who to contact and how to get what you need at the right time can feel like entering a maze. Imagine yourself in the centre of a circle of support with your family and friends, your GP, other health, community services and supports around you. You may feel less anxious about the journey ahead. Which part of this circle of support is most useful for you will vary with the different stages of your palliative care journey. Your GP is a vital part of your circle of support. He or she will know your history, your family and your circumstances and will have an understanding of what you might expect in the weeks and months ahead. They will often be the link for the circle of support to share information and to make sure things are working as they should be. Talk to your GP or the practice nurse about getting more help. They can make referrals to other support services for you.
It's often a good idea to link in with services early, even if you don't make use of them yet. Knowing what help is available may help you feel more secure. Ask your GP or local health centre if you need some extra help now.
Tas CarePoint is the central point of referral to most services available in Tasmania. Your GP, health centre or hospital will send your personal details and request for services you need to Tas CarePoint. If you contact Tas CarePoint yourself, you will speak to someone who will guide you through what you might be eligible for. If you are already getting a community service, talk with them about any changes to your needs. When you first have contact with a new service provider, they will probably ask you a lot of questions such as:
Is your health condition stable or changing? What do you need some help with? How much help do you need? What services do you already receive? Do you live with people who can help you? Community nurses are often the first people you will see after contact with Tas CarePoint. There are community nursing services based in most large towns in Tasmania. They visit people in suburbs, rural towns and villages, wherever people live. Community nurses can assist you by being a helpful link with other services, as well as providing nursing care. They will work with your GP to make sure you are feeling as well as possible. Help with managing housework can be really useful for people who find it difficult to keep up with heavier tasks at home, like changing the sheets on the bed, cleaning floors, bathrooms, or getting dressed. Tas CarePoint is the usual referral pathway for you to obtain home help services.
Getting about inside and around your house or out in the community can be made easier with the right sort of equipment and planning. It may help your family provide your care more safely at home too. Occupational therapists advise about equipment and home modifications to help you maintain your independence. Physiotherapists help with management of pain and breathlessness or fatigue. They can teach you how best to deal with these concerns. Occupational therapists, physiotherapists and community nurses work together to make sure you get the right support to meet your needs. Hospice at Home is a Tasmania-wide organisation that provides services for people living with life-limiting illness and a life expectancy of 12 months or less. If you are on a waiting list for a particular service, but you need more urgent care, then Hospice at Home may be able to arrange with your current care providers to increase their services to help fill the gaps. Hospice at Home is accessed by referral through TasCarePoint.
If your symptoms and quality of life are not as good as you would like, the Palliative Care Service will reassess your needs. These specialist doctors and nurses will work closely with you, your family and your regular care team to make sure you have what you need to be able to stay comfortably at home. If you need to go into hospital to get some problem under better control, they will help coordinate that too. Hospice and palliative care volunteers may be available to support you at home. The volunteers might spend time with you while your family carers take a short break. They could take you out for some social contact or to help you continue your hobbies or interests. You can contact the local volunteer service yourself or ask one of the nurses to make the referral for you. There may be other volunteer services in your local community who are able to help too. Grief and loss are a big part of living with life-limiting illness as you and your family adjust to the changes that come along the journey. Tell the people who are caring for you about what is important to you in how you live your remaining life. Discuss your goals and needs so that everyone might understand how they can best support you in living now and adjusting to the changes ahead. Living with life-limiting illness brings a range of emotional, social and spiritual reactions. Your circle of support might include good friends, workmates, your faith community, clubs and other groups you belong to. Extra help for you and your family can come from social workers, pastoral care, art and music therapists, counsellors and psychologists. Some people find massage and other complementary therapies are helpful too. Your care team will guide you in finding what you need.
Family and friends who are caring for you might sometimes need some support too. Having someone to talk to, taking a break from the caring role, or meeting other carers can make a big difference for them. Contact Carers Tasmania for information about what support is available in your area.
The team involved in your care will want to talk with you and your family about how and where you want to be cared for as you near the end of your life. Dying at home is possible, with some planning ahead to make sure that any equipment or other supports are available and that you and your family know what is likely to happen. Usually people have lots of questions, and there may be worries about coping with some of the practical and emotional aspects of care. Keep talking with your care team about what you want. As things change, you may make different decisions. Open communication with everyone involved is vital to making sure you and your carers feel well supported.
Advice and support can be provided overnight and at weekends by after-hours doctor services and in some areas by the local palliative care, community nursing services or hospice at home. Talk with your GP about what you should do if you need attention overnight or at weekends. Planning ahead is always better than having to manage an emergency situation. Find out from your community nurses and palliative care team what support is available in your area. You may never need to call after hours, but it is better to have information about what help you can get if you need it. It
isn't always possible to be at home throughout your palliative care journey. Sometimes a short stay in hospital or specialist palliative care unit is needed to sort out difficult symptoms and have you well enough to get home again to enjoy your familiar surroundings. For some people, a hospital or other inpatient facility is the right place to be for your last days. Your care team will help you work out what is best for you and your family.
There are inpatient facilities all around Tasmania. The Melwood unit at Calvary St Luke's Hospital in Launceston has public and private beds for specialist palliative care. Each of the district hospitals in the north have 1 or 2 palliative care suites. In Hobart, specialist inpatient palliative care is available for public patients at the Whittle unit. The Gibson unit at the St John's campus of Calvary has combined oncology and palliative care beds for private patients. Specialist palliative care doctors and nurses see patients at the Royal Hobart Hospital. Rural multipurpose centres also offer palliative care rooms. There are palliative care beds at the North West Regional Hospital in Burnie, at local hospitals in Smithton, Queenstown and at the Mersey. Residential aged care facilities around the state provide a palliative approach to care, and they may be a good option for you to consider.
A palliative approach acknowledges that grief is a part of the whole journey from diagnosis to death, and that emotional adjustments to loss are made at every stage. The support of local community connections, family, friends, colleagues and neighbours will often be all that many people need to cope with their emotions and responses to their grief. The specialist hospice and palliative care volunteer services in each region offers a walking through grief group for people whose family member or friend has died. Community health and palliative care social workers or private counsellors may be helpful too. From this presentation, you can see there are services available throughout Tasmania for people who face life-limiting illness. A palliative care journey will have emotional and practical hurdles along the way. Help, care and understanding are available. Ask your GP or community health service about getting the support that you and your family might need.
If you want to know more about a palliative approach and what you might expect to happen during the course of a palliative care journey, there are links to other short films, fact sheets and other information from the Palliative Care Tasmania website.